Hi, I'm Jose Armenta, and this is your Federal Employee Benefits, where we cover topics aimed at helping first federal employees like you make smart financial decisions. Today, we're going to discuss whether federal employees should enroll in Medicare. And I'm really excited about this video because as a financial planner for federal employees, I get to answer a lot of questions. But one of the most frequent questions I get is the Medicare question. For federal employees approaching retirement, the question is often whether they should enroll in Medicare. And so I know this video is going to help a lot of you out there, which is what this channel is all about. So if you're new here, hit that subscribe button so you don't miss any future videos. Okay, let's dive in. Okay, so the first question that we have to answer is, when does the Medicare decision need to be made? Okay, now, if you are an active federal employee and you plan on separating after age 65, okay, you plan on retiring after age 65, then you'll need to make your Medicare decision, whether to enroll or not, when you separate from federal service. Okay, so if you plan on working after age 65, then when you separate, that's when you'll make your Medicare decision. Now, if you plan on retiring before 65, then you'll want to make your Medicare decision at age 65 to avoid any late penalties, okay, late enrollment penalties. Now, while I'm not going to dive into the late enrollment penalties in this video, I'll include a link to an article below where I cover those penalties. Okay, now, if you are a higher income federal employee, meaning your modified adjusted gross income, which for most of you will be your adjusted gross income, AGI, you can find that on the first page of your tax return, the 1040. If that number, your AGI, and is above 194,000 for this year, okay, it's a moving threshold, but for this year, 2023, if that number, if your AGI is above 194,000 and your tax filing status is married, filing jointly, then you will be subject to a surcharge when you enroll in Medicare. So if you enrolled 2 years from now, because it's a 2-year look-back period, so if you enroll 2 years from now, they'll look at 2023. So let's say you turn age 65 in 2025. They will look at this year's income and see if you're above that threshold. If your AGI is above 194,000, then you'll be subject to what's called an income-related monthly adjustment amount, or IRMA. It's a mouthful. You'll be subject to that amount in addition to the Part B monthly premiums and Part D monthly premiums. Okay. Now, for single filers, that amount is 97,000. So if your AGI for 2023 is above 97,000 and you're a single filer, then you will also be subject to that IRMA, the additional surcharge on top of Part B and Part D monthly premiums. Now, for most federal employees, the center of the conversation around Medicare is going to center around Part A and B. Okay, for most federal employees, it does not make sense to enroll in Part C and Part D. Now, let's go back a bit. Medicare is made up of 4 parts. Okay, Part A and B, which is known as Original Medicare, and then you have Part C, which is also known as Advantage, and then also Part D, which are your prescription plans. Okay, now for most federal employees, the decision is going to be revolving around Part A and Part B. Okay, it just doesn't make sense for most federal employees to enroll in Part C and D because there's so much overlap between your FEHB and these plans, right? Most FEHB plans are going to provide sufficient coverage, and you're not going to need a Part C, and you have prescription coverage in your FEHB plan. Okay, so for most federal employees, the evaluation will be around Part A and Part B, which is why in this video, that's where we're going to focus, okay, on Part A and Part B. Okay, now that we know when you need to make your Medicare decision, let's look at the factors that should be considered when evaluating whether it makes sense for you to enroll in Medicare. Okay, now there's 2 primary factors that should be considered. The first is coverage. Okay, not just the coverage you need now, but also the coverage that you may need during retirement. Okay, and then also costs. Okay, what are the costs? Okay, comparing the cost between staying enrolled in FEHB alone or combining your current FEHB plan with Medicare Parts A and B. Okay, so we're going to look at both. Now, let's look at Part A first, Medicare Part A. Okay, so Medicare Part A is known as hospital insurance. Okay, Part A helps cover inpatient hospital care, home health care, lab tests, surgeries, hospice care, and prescriptions when dispersed in inpatient care. Also, skilled nursing facility care. Okay, so that's Part A. Now, the cost for Part A is there is no additional cost. Okay, that's the great news about Part A. Now, and this is really why it makes sense for most federal employees to enroll in Part A, because there is no additional cost. Okay, and the reason why there is no additional cost is because you pay the cost throughout your career. Throughout your career, you are subject to Medicare tax, and so you cover the cost of Part A. So for most federal employees, it's going to make sense to enroll in Part A because there is no additional cost and you get some additional coverage. Okay. Now let's look at Part B. Okay, Part B is known as medical insurance, and it covers healthcare provider services, outpatient hospital services, durable medical equipment, ambulance services, and some preventative services. Now, Part B does not cover routine dental care, eyeglasses, hearing aids, immunizations, or prescription drugs. Now, with Part B, unlike with Part A, there is a monthly premium. Okay. Now, for this year, this monthly premium changes year to year. For this year, the monthly premium is $164,090. Okay, that's per person that's on Part B. Now, that is if you're not subject to the additional surcharge, okay, or any late fees. Okay, so that's just the Part B premium alone. Now, while FEHB and Medicare Part B will have quite a bit of overlap in terms of coverage, Medicare does provide or may provide some more extensive coverage in certain areas. For example, Medicare may provide more coverage for orthopedic and prosthetic devices, durable medical equipment, home health care, medical supplies, and chiropractic care. Now, while Medicare Part B does provide or may provide that additional coverage or more extensive coverage, your FEHB plans will provide emergency medical care outside of the U.S., which Medicare does not provide. So while there is quite a bit of overlap, there are some benefits or maybe some benefits to both plans. Okay, so now let's look at an example of how you may be able to evaluate the cost and savings of enrolling in Part B. Okay, now when enrolling, so we're going to look at Blue Cross Blue Shield Basic Plan, okay, and how that looks when combining with Parts A and Part B. Okay, so when combining with the Blue Cross Blue Shield Basic, okay, you'll see that your plan, the FEHB plan, pays for doctor's visits, telehealth, urgent care visits, hospital visits, your deductible, okay, they waive the deductible and co-payments, okay, for the basic plan. They pay Medicare deductibles, okay. So there are some significant savings on the FEHB plan side. Now, what do you pay when you combine these two plans? Well, you'll see you pay your FEHB premium. That doesn't change. You're going to pay the Medicare Part B premium, and then you'll have some pharmacy costs, okay? Now, let's look at an example of the potential costs, okay? Now, while this is a straightforward example, okay, it's a simplified example, okay, to give you an idea of what the cost and savings could be, okay? Now, let's say that you have FEHB alone, okay? Your premiums, let's say you have the family basic plan, your premiums, your monthly premiums a year would be $5,090, okay? Plus, let's say you visited the doctor twice, okay? So 2 co-payments, $60. Your total cost would be $5,150, okay? And that's not including x-rays, any inpatient care, or anything like that, right? Very simplified example here. Now, let's look at the cost if you were to combine your FEHB with Medicare. Okay, again, this is for Blue Cross Blue Shield basic plan, family plan. Okay, so if you combine your FEHB with Medicare Part A and B costs, you're going to have the same monthly premiums, right? Your FEHB premiums don't change. There are going to be no co-payments because, again, the co-payments and deductibles are waived when you're retired and Medicare becomes the primary payer. And then your Medicare premiums, okay? Now, this Medicare premium amount, with this plan, you get something called a reimbursement, okay? The FEHB plan reimburses you $800 when you provide proof that you're paying monthly Part B premiums, okay? So that reduces your Medicare premium amount here, and you'll see the result there. So that $1,179, that is the net amount once you include the $800 reimbursement that the Blue Cross Blue Shield plan provides when a federal retiree is enrolled in Part A, Part B, and provides proof that they're paying the monthly premiums. So after you take that $800 reimbursement into account, the savings for co-payments, the total annual cost is $6,269. So that's an additional cost of $1,119. Okay, but again, this is a simplified example. Okay, there is no inpatient care here, no specialty care here, and only 2 visits at $30 co-payments. Okay, with two $30 co-payments. Had this example included a hospital stay or specialty care, the FEHB and Medicare combined could have easily saved the federal employee money. Okay, so it's something to keep in mind that given the savings with some of the FEHB plans for a lot of federal employees, it may make sense to enroll in Part B, especially as your healthcare needs and retirement will likely increase. Determining whether you should enroll in Medicare requires careful consideration of both coverage now and your coverage needs in retirement and costs. And now the costs may not be as straightforward as adding your FEHB and the potential Medicare Part B premium costs, but as we saw in the example, you should include the savings that you may receive from your FEHB plan when you enroll in Medicare Part B. I hope you found this video helpful. If you did, hit that like and subscribe button. That's the best way to support this channel and to let me know to continue to make these videos. And until next time, I'm Jose Armenta. Take care.